So just kind of a little bit about me for your audience, and we're going to be cross-recording this for our podcast as well. So we're just really getting information out there. So yeah, I am a physical therapist with almost 14 years of experience within physical therapy at large, and started my practice really within like the neurological space, and it really made me become more and more of a holistic provider and what that really meant, and going through life changes, becoming a mom twice, and all of that fun stuff, really dove deep into pelvic health. And that is becoming more and more of a household name. And which really is all due to things like this, like podcasts, like community events, like getting out there from the practitioners more so that way we can get right to the community. So I thank you so much for letting me come on. But yeah, being within the pelvic health space, being also within lipedema and how those two specialties do come together. And I'm huge with collaboration with other practitioners. And that's why I love collaborating with you, Ashley. I was just telling you I was on and collaborating with a local chiropractor. So I really do practice what I preach here at North Star Physical Therapy. I started my practice, it's about 3 years now, which is crazy already. And have my office space here in Fairfax, Virginia, for those that are listening in the DC metro area. But yeah, just really love growing in this space and growing in collaboration with other practitioners for one goal, and that is for you to achieve optimal health.
Love
So
that.
again, thank you for having me.
We're all about the holistic health over here. All my listeners know that. So that's why I love bringing people from different areas of wellness because it all connects, like Shirley was saying, and how her two kind of household name now for what she's known for, her niches, you could say, that she's becoming more and more passionate about as she goes along, gearing towards these two topics and just how much they overlap and integrate and how much they overlap and integrate with everything I do. So I think it's so cool. Women power. We can come together and make the magic happen here. So if you want to give the listeners and me, honestly, some extra insight here, like what is pelvic and lymphatic health and why is it important for people, especially for women? I know you noted too, being a mom of two now, this is something you've become more passionate about. So we would love to hear a little education and background on that to get started.
Yeah, absolutely. So when we're talking about pelvic health, and I am at North Star Physical Therapy, I am a very inclusive therapist, but I know for the sake of this podcast and because your clientele and listeners are women, which is like hoorah, yes, I do want to plug a little bit of like males and for those within the
Yes.
LGBTQ community, especially with the changing world climate we are now under, that I'm just pulling up my flag and saying, hey, I'm here for you too. But I totally understand. Yep, we're going to be more feminine, more female focused, those identify as female. So yes, okay, cool. But pelvic health is huge. Not only is it literally the keystone of our body, it quite literally, if you look at a pelvis, it like it's exactly like a little keystone. And it is the central part of our body, not only just like our skeleton, but also there's so many functions that happen there. So any urinary function, bowel function, sexual function, those are and like the just support. Those are like the kind of main functions within our pelvis. It also helps to stabilize our spine. It helps to stabilize our lower half too. So it's getting like feedback and it's getting that from the top down or from the bottom up. So the pelvis is very integral with how we move, with how, yes, we function on a daily basis. Everybody's got to pee, everybody got to poop, everybody's got to have pleasurable sex, and we want that all pain-free, right? So there are a lot of things, and yeah, I talk about that all the time. And so it's funny, I actually was just at a pelvic health conference with other small business owners and who were like kick-ass women out there. And we realized like, yeah, we are a special breed of physical therapists. Like we can just sit there and talk about these kind of things all the time, but we want to help normalize that conversation. So public health is very huge for those women, especially going through menstruation, going into potential pregnancy within there, as well as perimenopausal and postmenopausal. Our tissues change, our hormones change, the bodily functions will change. And so how much of that can we really act upon and that we can help with that wellness? And so when you're talking about urinary function, like who wants to leak all the time when they cough, sneeze, laugh, jump? all of that. Who wants to have like hesitancy there in the stream, bowel functions, any leakage there. So like our runners and like the impact sports and they maybe have fecal leakage. We don't want none of that. Or if you're constipated, right, after you had like your baby, or after you had a surgery, or your medication changed, and we have some issues there, and you fell and hurt your backside, and we're having bowel issues. Again, all throughout pregnancy, our orthopedic structure completely changes when we're pregnant. And then whether or not it comes quote unquote back postpartum or not, or you just own what your body is at that point. Sex cues, and sex is very different from everybody, right? So when someone says they have pain with sex and they come into my office for that primary symptom, I first want to get educated from the client. What does that mean to you? Is there a position thing? Is there like a lubricant involved or not? Is there a toy or a tool or foreplay? Or what does sex really mean to them? Is it oral? Is it digital? Is it penile and vaginal? Is it maybe with like within a homosexual partners? Like we want to get educated what that means to the client so that way we can best move forward on what that treatment is. Yeah, is it vaginal? Is it anal sex? And there's a huge umbrella right there. And coming up to St. Valentine's Day here, we want to make sure we can have that with a lot of fun and pleasure for sure. But people can have pelvic pain for other reasons as well, not just with an intercourse and penetrative sex, but it could be maybe they have these ongoing infections and their nervous system is just so heightened. And so any little thing can set off that nervous system. And what happens when you're in pain? What happens when you're scared? What happens when you have anxieties? You guard, right? Your muscles just tense up. And sometimes people think like their pelvic floor is weak, maybe because they have that leakage or something, but it may be because their muscles are so guarded, they can't relax to then fully engage it. So all of those things, we really try to take a dive in deep in what is the root cause? What is the why? And that's why within my practice, I spend up to an hour with all of my clients, one-on-one, hands-on, and really finding that those root causes. And that may take a couple of sessions, and that's okay. So that way we know what the cause is and how it's connected to your symptoms so we can work and resolve the symptoms. Then we challenge the system to see, did anything flare up? Did anything like exacerbate a little bit? And then we're on the path to that wellness. So oftentimes people stop going to therapy. They're like, oh, like I can have pain-free sex. Great. I'm not leaking. Excellent. But to be challenged enough, right, within things so we know it's not going to happen again. We build up that resiliency. And therapy can be, depending on the person, can be a little bit of a longer process. For some, they have that symptom resolution, but it's okay, that happens within maybe a couple of sessions. We do a couple of challenging things and still you're okay. Excellent. So it is very individualistic, and that's where collaborating with other practitioners to really help get down to the why, get down to all these things, and then to appropriately challenge somebody, like with a trainer like yourself and like things like that. Hey, how are they doing? What are the techniques? Like,
Yeah.
all of that is really helpful to help bring somebody to that wellness within the pelvic health space. With the lymphedema space, that is like an accumulation of fluid for one reason or another. Again, getting down to the why. Oftentimes there is a medical thing behind it. And so that's where my specialty within lymphedema is we make sure we have the right conservative measures on board with that mobility pieces. So we're getting the movement, we're getting the strengthening, we're getting all those things. Maybe we need to have a compression garment. Maybe we need to do some manual lymphatic drainage. Maybe we need to make sure we're doing some elevation of whatever limb. Sometimes I have folks that have like pelvic congestion of the lymphatic fluid, and that's what's giving rise to some of their pelvic pain. So you see how they can definitely interconnect, and that's where a lot of practitioners within lymphedema found that to be true, and now they're doing more pelvic floor stuff. So this is definitely the cutting edge coming forward within our practice here. Long big question answer there,
No,
but there's
that's
a lot. Do it. Yeah.
We love long answers here, so we're here for that. That's amazing because I love how you said like it's literally the keystone of the body, your pelvis, and it is cool to hear just the work you are doing and it obviously us being aware of how our pelvic health can be affected, what symptoms or issues might arise when it comes to that is so beneficial because a lot of people might have like pain, a lot of pelvic pain. They might have painful intercourse. They might have issues with bowel movements, urinary tract
Mhm.
infections, and it just might be considered their normal. So it's cool when we can get to the root, which we're all about here, and we can dive deeper and be like, okay, here's like some interventions. Here's the bigger picture with this, what might be influencing it. Here's how lymphedema, tongue twister, plays a part potentially as well. So it is cool to see that connection and just, yeah, bring that awareness of, okay, this is such a vital part of our health and body that honestly I feel like probably isn't about enough. So I love that you create such a safe space. And I love how you emphasize the importance of, yes, obviously, like my ideal client, my clientele is are women, but you're like, let's talk about how this is important for everyone. And I love that you note that because I think that's also something that doesn't get as much attention as it should, but it really is just such a vital part of health for everyone.
1,000%. How many times as women are we told at the physician's office, oh, that's just normal, that's common. Like you have, for example, like your cycles, right? Everybody's cycle is so different. And if yours is like more painful, that's not normal. So that may be common, but it's not normal. And so to help demystify like a lot of those myths and to empower my clients with that self-awareness and for that, no, we're going to be an advocate and we're going to push a little bit because we need our other providers for sure, but sometimes like they don't have the time because within their business model to really do that. So I'm like, okay, look, we get
Sure.
it. We can't fight that one. Right? Like unfortunately, like with the insurance space
Yeah.
craziness, right? So if you only have 5 minutes with your GYN, right? Let's make those 5 minutes count. So it's like I make sure I'm empowering my clients. Okay, we need you to ask this question, get
Love
this
that.
answer, and there you go. So that way, like it's worth their while, and then they're not leaving the appointment. Oh shit, I didn't ask this or oh whatever. So I like to empower folks like this might be a common symptom of menopause or postpartum stuff or like whatever the case may be, but that doesn't mean it's normal. So I know like a fun new term that's coming out there now, which is so much better than the last one, is dealing with these genital urinary symptoms of menopause. The old like term for menopause symptoms was vaginal atrophy. Like, how awful is that?
That sounds literally so terrible.
Right? Did you just get like that visual of just like a raisin? That's
That
awful.
is
Like
terrible.
that will give people a complex, right?
Yeah.
Oh my God, is my vagina still there? Is it still working? Can I still use it? What's going on? But it's the symptoms. It's not like your vagina isn't atrophying. It's not shrinking up, right? So now the new term that's out there now is genital urinary syndrome of menopause. We often see urinary incontinence. We often see vaginal dryness, not shrivel. We see
Yeah.
dryness and the tissues being reabsorbed because there's a loss of estrogen and progesterone. And there are things that we can do about it. That's so easy to implement. That talking to your provider, talking to a pelvic floor therapist, getting an assessment, really seeing what should we talk to our provider about. So oftentimes I'm catching those symptoms like in my pelvic exams. I'm like, hey, the next time you go see your GYN or your urogynecologist, or your primary care provider, let's talk about vaginal estrogen. So it's like really helping them empower like this is very common, right? But doesn't mean it's like normal for you to be having these symptoms, but there is a treatment that can be very effective and be very helpful and to nip those symptoms in the butt so you can continue on with pain-free sex, with no leaking, things like that.
Yeah.
Yeah.
And no, and that's so great. That makes me think of what are things that we can be doing as women to help support our pelvic health, have a strong pelvic floor. What should we be doing? Especially, I know a lot of my clientele, like we've spoke about, really ranges so wide age-wise that I have many women who are in that stage where they're having kids, they're ready to have kids, or all the way to menopause, post-menopause. Yeah, let's take like a deeper look there. What can we be doing as women to, yeah, keep it help support our health there?
Yeah, I think half the battle is keeping the conversation going, but then not just bitching about it to your friend, right? That can be your confidant, like totally good, you're getting off your chest, and that's definitely needed. But you have to be an advocate and go to see a pelvic floor physical therapist for sure. So if you're having any kind of urinary issues, bowel issues, sexual function issues, pelvic pain, or even just want to get assessed. Oh my God forbid we like be like preventative with stuff. There are, and like myself, so there are definitely physical therapists. Like we want to be a part, like you're like dentists. You see them every 6 months.
Yeah.
That's part of wellness. Come see, let's see what's going
Yeah.
on. So I've done like workshops and things like that. Mention that, yeah, just come on in. Let's assess the tissues, not just at the pelvis itself, but like from head to toe. Get a postural assessment, get a muscle strengthening assessment, joint mobility. Let's really check out things. So maybe it might be just fine tuning. And if you're already connected with the trainer like yourself, then I'm like, hey, Ashley, can you make sure you guys are really working on this? Or
Yeah.
hey, I found this. We're going to be working together for a few weeks here or up to a few months because to really see good change, we should be seeing some level of change within the first 3 to 4 visits, but definitely good like muscle memory, adaptation, and those kind of changes can take a few months. But doesn't mean I see you every week. But
Yeah.
it can really help with that collaboration to do those things. But yeah, to be the best advocate for yourself when you have that gut feeling when you're like, is it really normal if I have to wear a pad every time I'm working out with Ashley? Or like when I go lift like a higher weight and I try to progress my resistance training, it's like I leak a little bit, or I go for my run and like I got a smear in my underwear when I get back home, or I had sex with my partner and it was more painful, but I just sucked it up because we're trying to have a baby. Like that's not okay either, right?
Yeah.
And so with that, it takes two to tango. So I often am talking to the one person that maybe is more vocal and talking about they have discomfort. But I'm like, how about your partner? How are they doing? So I just did a whole podcast about like dyspareunia or pain with sex. And so feel free to check that out, guys.
Yeah.
But yeah, there's so much within that spectrum for women that we all have that community and we love to build that community with one another. And be talking also to like your mom if you're able to, or your aunt or your grandmother, and asking like the maybe the little genetic components. So especially for those that like are transitioning more in the perimenopausal space, when did mom go through menopause? When did grandma go through menopause? And that can give you a hindsight about maybe you, because genetics have a huge component to that. If someone is within the pregnancy and childbearing years, it's like, how was their pregnancies? How was their labor? Did they have a vaginal delivery? Did they do C-section? And we're not going to shame mamas for that. It's like my big,
No, never. I'm
yeah,
a
so
C-section
bad.
baby. As a twin, I'm a C-section baby. My
Yeah, me
so
too.
yeah.
And I had 2 C-sections. The
There
first
you
one was
go.
labored, the
Yeah.
second one was a planned. I'm like, she's out of here. Yeah.
Yeah.
But yeah, we don't do any mom shaming and this and this, like, what
No,
you're feeding
never.
versus formula. Dear Jesus, just feed the baby, you get healthy, we'll be all right. But yeah, I think women, we have a unique perspective because our body's constantly changing.
That's
And
gold. That is gold right there, that statement.
it
Amen.
is constantly changing, and we have to give ourselves grace, right? And we got to give some patience because we do a lot. We really do. My husband's sick at home today and it's like his deathbed. I'm like, baby, you got a cold. Like, just, you'll be fine.
The
While
man
like
flu.
we're menstruating, you're doing like the whole grocery store shopping. We have full-time jobs, or we're taking care of
Yeah.
the kids, or we're doing all sorts of shit where they're like on their little deathbed with the cold. I'm like, just relax.
I'm sending this clip to Alex.
You should. Don't kill me, but it'll be fine. You know.
Love you. Love you, honey.
Through their own like hormonal little change, but it's
For
not every
sure.
month,
No,
right?
it's very different. We are built very,
We're
yeah,
strong.
we're strong women here. No, that's amazing and all such good insight and such a good note too of each phase of life. It's going to be different. Someone could have experienced a lot of these issues through many phases of life, and maybe that does feel common or they're normal, but it doesn't mean we shouldn't get it checked out. Or it could be that in a new phase of life, maybe a new mother or maybe someone entering menopausal or postmenopausal, right? Like these different areas, we can experience new things. And I just love how much as mentioned, the safe space you create of you don't need to feel shame. Let's get to their root. Let's also look at the history, right? Knowing like family history is important. So I think these are a lot of good touch points that hopefully everyone listening, if you resonate with any of these things, you're taking note, like little checklist. Okay, so let's go through. And I did want to touch on some about fertility. So obviously, like
Mhm.
with pregnancy, and then with if someone, no matter what type of birth they have, having that pelvic floor strong and making sure our pelvic health is in an optimal space important. I don't know if we want to expand a little bit more into that topic too, of
Yeah.
kind of what that looks like pre, during, and post pregnancy. And I'm gonna pull out my notepad because it's to take notes here now.
Yeah. So my role as a pelvic floor physical therapist is to help get the environment of the pelvis, uterus, vagina, because we're just talking about female pelvises right now, get that optimally functioning. Not just like functioning, but we're getting good blood flow. We are getting good flexibility. So a lot of things, and I like how we need to make sure we're strong. Absolutely, 110%. But we also need to make sure we're flexible there too. It is an amazing muscle structure there that everybody just goes to Kegels. And it's like, oh,
I
they
guess
have their
everyone
place.
thinks so. Yeah.
It's like we're like shriveled up, or we just have to constantly be Kegels. Like, why are we having such extremes? I don't get it. Kegels definitely have their place, 1,000%, and especially when there's true muscle weakness. Yes. And that is something that really needs to be assessed internally. So if you're told by a provider to just do Kegels, did they touch your pelvis? Did they assess those muscles there? If they did not, go see a pelvic floor physical therapist. Even some people, unfortunately, within pelvic floor physical therapy claim to be a pelvic floor PT, but they don't do any internal work. I would be a little leery about them telling you to just do Kegels. I
Yeah.
have many colleagues that do not do internal work, but they are freaking brilliant with external work and with exercise progressions and amazing. And they just don't do any internal. That's fine, but that's why we collaborate together. So I have had clients that come and I do the internal work and then we like pair up like that. But I'm talking to the urogynecologist, the OBGYN, you go for your 6-week follow-up appointment, which 6 weeks is a bullshit number, by the way. There's no research behind the 6-week mark. I don't understand why. But they say, oh yeah, you can go back to sex, just do your Kegels and you'll be fine. What? We just had a child 6 weeks ago. Are you kidding me? So,
Yeah.
but with fertility, we want to make sure we're setting up that environment for success. We're looking at soft tissue mobility. Maybe somebody had a scar in the area from previous abdominal or pelvic surgery. Maybe they have endo and we're dealing with or endometriosis and we're dealing with really painful menstruation, a host of things. And we want to make sure we're getting to the root causes and we're solving those symptoms as best as we can. Maybe also with collaborating with medical management, totally, And so that way, my role is not to actually have the conception happen, right? Like, we're not that powerful, right? But to have the environment set up for that is really important. And then, so I say I'm like a sex counselor. I'm not a sex therapist, and there is like definitely certifications for sex counseling, really being a certified, which is amazing. My business coach is
Oh no, it's
a sex
frozen.
counselor and talk about all sorts of stuff. And our role is not to say you must do doggy style. You must be in this position. No, let's just see what works for you and your pelvis and angle of entry and like all the things. So that way, when you're getting down to the activity, it's not painful. It really is pleasurable. And the system, the environment is optimal as much as we can so that fertility can hopefully, biology can hopefully happen. And then not to shame the folks that have to do IVF or IUI or something like that. Okay, they just needed some assistance. That's great. And we want to support them in that. And
Yeah.
it's okay. So biomechanically and nervous system and all the things and cardiovascularly and mobility and movement, we want to support all of that. So that's what I work on within like the fertility. And then I keep going with clients into their pregnancy, often for those that have to do those alternative measures for IUI or IVF. Some of them most often are like deemed like kind of high risk. And so we really are collaborating with the OBGYNs and the maternal medicine folks so that they can still optimize even within maybe some restrictions, they can still be doing really well to prepare for labor and delivery. So by 37 weeks, when I'm working with somebody, they know everything for labor by that point. I mean, like our system is doing all well. Our tissues are flexible. We're able to get into labor positions. We're able to breathe in different ways. We're able to lift all the baby shit, even with having a baby. They're teeny little things, but they have a whole bunch of stuff. But can we do that without leaking, without having any pelvic pressure, without any of those symptoms? We go through all of that within the pregnancy. So that way, postpartum, I follow up with folks a good 2, 3 weeks afterwards virtually just to see like how are they doing and what's coming up with mobility wise because hormones have shifted again. And then we start a new plan of care postpartum. So I can see a client from like the very beginning of their fertility like journey all the way through their postpartum journey and returning back to whatever the one they want to do, or maybe think of like new things, or maybe there was like a long-term goal or things like, yeah, let's work with each other. So it's really cool to see somebody work with somebody throughout the whole like gamut. And then sometimes it's, yeah, and then they come back to me and it's like, now I'm perimenopausal, or a lot of women in the DC metro area here are having kiddos a little later. And so we're like in that gray area of postpartum and perimenopausal, like at the same time, and how we work with all of that.
Yeah, no, wow, that is so like insightful, all that information. So thank you so much for sharing all that. It's great things to think about that when you go into a new phase of life, it might not even cross someone's mind, but that's so crucial to make sure that we're touching base with all those things. And so on the other end
Mhm.
of that, going into perimenopausal, menopausal, postmenopausal, what does that kind of look like with your clients as well?
Yeah, so very similar. They could be coming in with some sort of symptom already. And we go through like that assessment and those like phases of treatment, like I mentioned earlier. But with them, we're looking at the hormonal health, and there are like non-medication related hormonal treatments that we can do. But then there are sometimes the need for hormone replacement
Yeah.
therapies. That's okay. And I think there's a lot of misinformation out there when it comes to hormonal therapies that it can cause breast cancer and all these things. And a lot of it's a huge lie, depending on what exactly kind of cancer risk the person is at. But there's a lot more research out now with that. And I love following folks. Dr. Rachel Rubin, she's a local urologist and sex specialist. Her group is just amazing. And so, yeah, follow her on Instagram, guys, for anything like menopause because she's amazing. But there are a lot of things in our body is changing. We're looking at bone health, we're looking at brain health, we're looking at cardiovascular health, our vulvar tissues, right? Have you taken a peek at her? Right? There are some people that like have either a stigma or there's no, that was just for baby making and periods, and that's it. It's like you got to take care of the tissues there too, guys. So sometimes it is a psychological thing that we have to like work through. And if that means I need to collaborate with maybe a sex therapist or a mental health provider, like let's do that. Because I really feel the pelvis, just like how it's a keystone, it's also 3 or 4 legged table. If we're only working on 2 out of the 3 or 3 out of the 4, but we're not handling this mental health piece, like we're not really going to be able to hold that table up really like a stib, like it's not going to really be
Sure.
stable. So sometimes we got to look into that a little bit and what are some active stress management techniques or down training. Someone's just like really super uptight or their nervous system is like on fire. And we often are seeing a lot of that within the perimenopause, menopause timeframe because in your 40s to 50s, look how much shit is happening in our lives, right? If you have kiddos, it's everybody's getting older. We're thinking about colleges. It's a big transition, maybe for the family. Into our 50s, we're about to embrace potential retirement in the next decade or so. What does that look like? And so a lot of people, they just gravitate towards that glass of wine is great. I'm like, that's not really the greatest thing for you at this point in your life. Glucose and sugars and how that can put a lot of weight onto your system. So there are all these other factors that we look at within the perimenopause, postmenopause phase that long term can help for the rest of your life for all those, again, brain health, bone health is huge, like osteoporosis, things like that. Because we live our life a lot longer within the perimenopause, postmenopause time than we ever do within menstruating years. It's like a lot, right? It's like a lot of people, it's about 30 years or so for
Yeah.
most folks, like your teenage to like 40s, 50s, so maybe it's 30 to 40 years, but then it's, I hope I'm not dying at 50. Like I still have another 30, 40 years left to go. We need to respect like that space as well within our life too. And women, we're strong mentally and psychologically, but we also need to strengthen up because there are natural changes with aging. So there is like the normal things, but there are also other common things that people are equating to normal, and it's really not. So to be able to talk to your provider or just say, yeah, direct access, go right to a pelvic floor physical therapist, and we can assess those things because we're physical therapists by trade. So we know orthopedic and all that kind of stuff. We just specialize within pelvic health. So I'll see folks for like pelvic stuff, and they mention, yeah, I'm like my shoulder is hurting me, or my hips or my knees. I'm like, yeah, let's look at everything. Let's do it.
It's all,
Yeah.
and it can be so connected. Like it's crazy how
Mhm.
things can be. I love that you look at the full picture. I love that you're like, okay, it's just as much mental as physical, but like we need to also focus on just looking at everything, looking at the whole picture to figure it out. So that's like my bread and butter. I know that's your bread and butter. That's why we
Heck
vibe.
yeah.
We're like whole
Heck yeah.
picture wellness. That's really what we're about. And so when it comes to like sexual health and intercourse
Mhm.
and going that side of things, what are some of the
Mhm.
interventions you do from the physical side of things with women if there's any that you haven't expressed already?
Yeah, again, my role is not to give you like one certain position, like you have to do sex
Yeah.
this way. Again, we have that discussion. What does sex mean to you? How are you orgasming? Are you just sucking it up or are you just faking it? What's going on? A lot of times I'm educating like the anatomy to someone. Like, again, take a peek at our vulva, just like how we are recommended to do like monthly breast exams. We need to have monthly vulvar exams too. Check her out, see how tissues are doing. And that's for any age, but especially within that perimenopausal, postmenopausal. But for sex related things, like oftentimes I'm educating somebody like their tissues, our vulvas are all different looking in shapes and colors and all the things, but what is your normal, right? So
Yeah.
sometimes if someone's having pain with like maybe penetrative vaginal intercourse, maybe one labia is a little bit larger than the other. And it's, oh, that skin is going in with penetration, and that's that pull, that's that, ooh, that little tug that I feel upon immediate, right? Okay, or if they are a little bit in that like perimenopausal, menopausal phase, is there some vaginal dryness there that we need to maybe help hydrate, whether through lubrications and what kind of lubrications work for you, that you enjoy? Do we need to start talking about, yeah, that vaginal estrogen, vaginal testosterone, things like that to help moisture or vaginal moisturizers? It's like chapstick for those lips, right? It's all good.
I love you, Shirley.
Yeah, I'm telling you, we're a special breed of therapists.
But I love how openly you can speak about all this. And so please continue.
Yes, yeah. So it's like we're looking at external tissues, right? What is that? We're looking at the joints. Can you get into some of these positions? How is your hip mobility? Do you like being on bottom? Do you like being on top? How is sitting position? Standing, like on all fours? Bleh. But and then internal, when I do an internal pelvic assessment, that's when I'm really seeing the soft tissue and the muscles. Are they able to relax? Do they contract? I'm educating women on the clitoris. Oh, clitoris is huge for sexual function. And women don't understand how huge of an organ it is. It is massive. And it has one job, and that's for orgasms. That's it. So it's like, why don't we use her? And
Put her to work.
like and self-care and self-love, right? And that can be deemed as masturbation, and that can be for purely clinical to bring blood flow and grab your partner. If masturbation is against your like religion and culture and all that, totally get it. So there are some within the sexual health space. There's some of that conversation that needs to be had too, like culturally, what are we looking at here? So we can respect that. So that way I'm not offering some like kind of treatment that's just never going to be a part of it, but also educating. So like I've had very conservative folks that I'm like, we really need to figure out a way to get these soft tissues like relaxed and flexible. And so we do that with a combination of things. And so that way, if pleasure starts to be coming, like, great, use it as foreplay because the end goal is still the same for potential fertilization. And so know that this is for that. And then there are some folks that are like, yeah, whatever. But we're talking throughout all those little aspects. And with sexual health, it is more, I feel a little more sensitive because there tends to be whether that's it's love like for yourself for sure. And then it's also if there is a partner of I sometimes need to get them involved as well because there might be issues happening over there too, physically. And that's why they have to be in certain positions. And then the other person's maybe sucking it up and just dealing because they know that, but then that's not benefiting them either. So it definitely takes two. But I'm going through yeah, hip mobility, pelvic mobility, tissue elasticity and flexibility. What kind of orgasms are we able to achieve? What the angle of entry is. So if a position is changing, so does the partner, right? What about the tissues? Are they symmetrical? Are they healthy? Foreplay. Let's talk about it. Like what? Here we go. But yeah, so you'll see in a lot of pelvic floor physical therapy offices, there's a lot of toys, there's a lot of lubes, there's a lot of models, there's a lot of that. And so that way we can address not only within clinic, but sometimes I need to have these conversations where the client feels comfortable and we're doing that virtually. And that's okay too. So to have that accessibility for a clientele is very important as well. So they feel comfortable because if they're in a very, or like you have that really good, safe homey environment. So,
Yeah.
okay, we can kind of let the guard down a little bit. And I'm only going to talk about whatever things that they are comfortable with talking about. I have a client who's a nurse or a midwife and just got married and has pain with sex. So I know she knows the anatomy, but as a clinician. So when she had to talk about herself, it was a huge wall. It was really tough. And so it's okay. I can only go so far, and I'm going to recommend like a mental health practitioner to be involved here so we can work through those deep rooted things before we do a physical assessment there. Or if they were comfortable doing a physical assessment, we can do that. But I know in order to achieve your ultimate goal, we need somebody else involved here too.
I love that. I love, and I've probably a broken record saying this, but I love how unique your approach is, how you really are like, okay, like it's tailored to the individual, and we're
Yes.
going to make sure that you feel seen. We respect whatever boundaries you might have. And we're going to really just make this approach make sense for you and not just looking at you, but also if you do, for example, have a male partner, like
Mhm.
what role potentially is this partner playing in this as well? Because I think a lot of time with anything related to sexual health or fertility, a lot of times we look at the woman, but I do think it's important to recognize there's two pelvises involved, like you
Mhm.
said. And so I actually think that would be a cool thing to touch on as well of what kind of part, if someone did have a male partner, what part would that kind of play with the woman, if that makes sense, like, and potentially maybe like painful intercourse, or what does
Mhm.
that kind of look like, if that makes sense.
Yeah. So someone's coming in having pain with sex. It's yes, we're going through all what does sex mean, all of that stuff we mentioned earlier. But then I'm also have like a vaginal dilator set out, and I want to know the functional size. Because okay, what are we working to for these tissues to be able to achieve flexibility? No judgment here, right? I'm like, I don't care if you're like the itty bitty or like a stallion. It just is like, where are we?
I'm dying over here.
So, and that's where I just say, like, all we're looking for is, I'm not trying to objectify anything, but like in a
Yeah.
way to help with that progress of, okay, because my finger, right, when we do an internal exam, is not your partner. And like a tampon is bigger than this, right? If we need to be able to do, and that's the other thing too, when we talk about like penetrative things, it's not just for sex either. Like, think of like menstruating, right? We need to be able, for
Yeah.
those that want to use a tampon, for those that want to use a menstrual cup or menstrual disc, pelvic exams for our OBGYN. We got to get our cervix checked out for a pap smear. There are several penetrative things that occur that we need to be able to tolerate. Of course, sex is wanted to be pain-free. So I often say, okay, where are we? What can we tolerate and what do we need to work to? And for some women, that's really helpful. And I see, yes, I'm able to maybe bump up on the next dilator with the treatment. So it's just tissue elasticity and flexibility is definitely
Mhm.
important. Pelvic positioning, if we need to tilt forward versus back, sexual position with that. Are we better sideline? Are we better sitting and controlling the penetration a little bit more? Is the penetration pain in the very beginning, like initial, or is it deeper? Because that can give rise to what layer of soft tissue is being impacted the most. And then yeah, what kind of level of like foreplay is going on to help bring like relaxation? What kind of active stress management? Do we feel like we have to be like cookie bunnies and because our kid are falling asleep and we like ripping and rolling? Or did we plan a date night and we were able to finally like really relax? So there are other like components other than just like the physical that we
Ah.
can look at for sure.
That's awesome. And I love that you share all that because it really does paint, like in our minds, it might feel if someone is experiencing this as humans, I think we just tend to think about the problem and maybe not all the factors that could be affecting or leading up to the issue. So I like that
Right.
you do a really great job painting a picture of all possibilities of what could be contributing to this, and that although it is physical, there's also, like we talked about, there's mental things at play there. Is there enough blood flow getting to that
Mhm.
area, right? Yeah, are we trying to be quick or are we taking time to really get in that right space? So I think all of that is such great things to think about. And then just to shift gears here and
Yeah.
go into, since you were freaking amazing giving us so much information with all that. And I want to just touch on before we go here a little bit on the lymphatic side of things. So I know like lymphatic drainage is like a hot topic nowadays. So if you want to explain what that kind of is and the benefits of that. And it's cool how we saw the connection to pelvic health. And so, yeah, if you just want to tie that together for us.
Yeah. Oh, big ask. Here we go. No.
I know I'm like, you got five
Lovely.
minutes. No, I'm kidding.
No,
I'm just
the lymphatic system, every system in our body, cardiovascular, nervous, lymphatic, immune, all the systems, they are not working in silos, right? They all work together. And so The lymphatic system works primarily with the cardiovascular system and with the immune system. So if there is any issues in those other two systems, you bet your bottom dollar that your lymphatic system is going to try to compensate and try to help out as much as it can. But when there is a fluid overload because of one reason or another, the lymphatic system needs help. And so that's where this accumulation of fluid may occur. Oftentimes there is, like I said, another medical reason why, and that's where secondary lymphedema is definitely more prominent than primary lymphedema. Primary is like congenital. It's like you're born with that. So maybe you have less lymph nodes or your lymphatic system just is not as efficient, is not as present, maybe in a limb as somebody that was born with a normal lymphatic system. So most of the times I'm seeing a lot of folks that have secondary lymphedema for one reason or another, whether it be venous insufficiency, a result of maybe cancer treatment like radiology or chemo. They had a lymph node removed for whatever reason. They've had like like varicose veins or something like that. Or they just have like chronic infections. Like they have these like immune like issues, like are like rheumatoid arthritis or lupus or something like that, where they're just like constant, like their immune system is just over and over. So I saw this a lot with COVID too. And like our immune systems were just like bombarded by this weird thing that we never had experienced. And the lymphatic system is like, what the F? And there are people that are getting like these or like after you got like the vaccine, right? There were people that maybe had like their armpit lymph nodes were like swollen or their neck lymph nodes were swollen. Oh, the shot didn't work. No, your lymphatic system was responding to what the hell is this?
Yeah.
And let me try to clear this out. So it's actually your system did respond the way that it should. It just went overload for you for whatever reason. I was like, what? So lymphatic drainage is used within the wellness space. It is used within like medical space, but I do people that they just want to have that detox, that decongestion of things. And so what's fun is your urine was once lymphatic fluid somewhere in your body, right? So your lymphatic system is filtered and your body recycles whatever it can, and then it eventually gets to the kidneys, which is where anybody on a diuretic, if you have swelling and you're on diuretic, it's not working, right? You've got to get that fluid moving to the kidneys for the diuretic to work, little soapbox, and then you urinate it out. So with women, we often see this with pregnancy, right? This is a symptom of pregnancy because we have this huge fluid overload. We have a child in its own circulatory system, and it's like we're having all this extra weight. And so we often get swelling. And so I often can do manual lymphatic drainage. We help with any kind of compression garment assistance, maybe some elevation techniques so we're not like cramping down on baby. Help like tie those like two worlds together. But manual lymphatic drainage, when done properly, because there's thousands of YouTube videos out there, when done properly, really, you see the effect of it right away. You will be able to either urinate more or maybe a little more often because you're literally moving fluid. So if anybody has that side effect, they did a good job. If not, that's okay. But you really want to make sure you're replacing the fluid that you're using too. So make sure you're well hydrated. But a lot of like massage therapists claim to do lymphatic drainage or lymphatic massage, and it's a little bit harder pressure, but it's not lymphatic drainage. So drainage and massage are two different manual techniques. If someone is claiming to do lymphatic drainage, they absolutely need to have CLT in the back of their those credentials as a certified lymphedema therapist and as somebody that knows manual lymphatic drainage techniques, how to modify it for the client if needed, and the other adjunctive things that need to be included, compression garments, elevation, maybe getting compression pump, different mobility things that will help with that flow.
Yeah.
For those that are lymphatic massage, that is a deeper thing, and that's a little bit more, it's just like a light, like soft tissue massage going in a retrograde or like against gravity direction, but it does it help? Sure, but is it really truly getting that superficial drainage going? No.
Hmm.
So it's just the why behind it, and that's okay. And so there are often people that I get that maybe said they got drainage before. I'm like, all right, show me what you did. I'm like, whoa, that is not what it is. Let's refine that a little bit. But it's a night I do with people with a medical like thing going on, as well as within the wellness space for just a good detox.
Yeah. No, that's like super helpful because I do think there people definitely mix that up quite a bit of
Mhm.
what on social media of people just I don't know if you've seen that people are just like, "Oh, I'm doing lymphatic drainage."
Right.
Now we know there's more to it than that, which is why I love to pick the brain of people in each field because obviously there is a lot of misinformation,
Yes.
unfortunately. This has been so fun, Shirley. You've been just a joy to learn from and chat with. And you even gave us some good laughs in there too, being your wonderful self. So thank you so much for coming on. Where can people find you, especially in the Virginia area, but also if they're not in the Virginia area, how could they use you as a resource?
Yeah, absolutely. Thank you. So my website is www.northstardpt.com. So on there has a lot of information. Feel free to reach out. That way I have a little contact form on the bottom of each page, and that will connect right into my email and give you a call like right away. I always get, wow, you actually called back. I'm like, yeah, because you reached out to me. I'm going to call you back. But yeah, feel free to reach out through my website on Instagram at Dr. Shirlea North. So feel free to DM me as well on Facebook, North Star Physical Therapy. I also have a podcast, North Star Physical Therapy, wherever the heck you listen to podcasts. And for those that are outside of the DC metro area, which is totally fine, I do have virtual consultations as well. That is something that if I can't be your like in-person physical therapist, I still want you to be educated. There are still a lot of things that we can share that we can make progress on, even virtually. And I think that was the silver line with COVID. We had to be very creative with how we do things. That's why I have models and stuff. So I can even connect virtually for those folks as well. And that way can help. What are those questions you need to ask your physician? What are those things that you need to make sure is happening in your in-person physical therapy session, things like that. So that way you're getting the results that you want and that you need and getting that optimal health as soon as possible.
I love that. Thank you so much. And I'll also plug that for anyone listening. I'll plug that in the show notes as well, all where to find her. But now you heard it twice, so you'll be able to click on the links and you heard it from her herself.
Thank you guys.